Hello everyone. You are in for a treat today. We are going to be covering chapter 8, which is all about naming those bones that we have in our body, also known as the skeletal system. Now, before we get into the actual lecture portion of the chapter, I do want to tell you that this chapter is set up a little bit differently from our other chapters. You're going to notice that there are lots and lots of images because obviously we're going to talk about the bones, what are their names, what are their functions, where are they located. However, when it's time to take our exam, there will be no images on your exam. So the question then is, well, how am I supposed to study for it? So this is what you need to do. In addition to obviously listening to this wonderful recording, I also need you to go back onto D2L and take a look at your Chapter 8, the Bones List Word document. I'm going to say that again. Chapter 8, the Bone List. It is a Microsoft Word document. It's about 7 pages long. It can be found in your Exam 2 folder on D2L. And when you open it up, you're going to see that I have listed all the different bones that we're going to talk about. And we are going to use that outline, that Microsoft Word document, as our study guide. And within that guide, I'm going to tell you exactly where the bones are located. If there is any specific structure you need to know on that bone, if there's a particular function you need to know on that bone, and that is then what you'll be studying for your exam. Now, don't worry, once we start actually getting into the lecture, I'm going to pause and give you some examples of how I'm going to be wording the questions. Now, in case some of you are wondering, well, why do I still need to look at the images? There will still be homework questions that you'll be completing on Connect that will ask you to label the bones, so you'll get lots of practice labeling. You just won't see it on the exam. It will also be very beneficial for those of us who are taking the lab where we have to identify the bones based on images to kind of get some extra practice in. So once again, if you don't have the Chapter 8, the Bone List, please go ahead and pause the video, go ahead and grab that document, and that is what you're going to be using to take your notes on, and that will then become your study guide for Chapter 8 when it's time to take our second exam. Now, if you're not really sure about anything, just as every other chapter before this and any chapter after it, please do not hesitate to contact me, send me an email, stop by the office hours, and I'll be more than happy to assist. All right, so without further ado, let's go ahead and let's take a look at our Microsoft Word document, our Chapter 8 outline, and we're going to see that on top of the first page, it says it's divided into 2 divisions. That's the skeletal system, the axial and the appendicular. So let's switch over and see what that means. All right, so here's one of our first illustrations, and we can see the skeletal system in full display. Now notice how it is color-coded. We have the arms and the legs regions that are green, and then the skull and the thoracic region, that's more in like a flesh tone, whitish off color. So the reason that's so is because it's highlighting for you the 2 main divisions within the skeletal system. Everything that is divided in green, sorry, I'm trying to get my pointer to work right here, is going to be the appendicular skeleton. Appendicular are appendages, so these are like extensions, so it would make sense that these would be all the bones that make up the arms and the legs. You will also have the girdles in the appendicular skeleton, and girdles are going to be your housing point, and those are going to be kind of like what makes up your shoulders and your hips. So we're going to talk about the pectoral girdle that kind of houses everything when we look at our arms and our shoulders and allows that full motion as we're swinging our hands side to side. And then we're also going to be taking a look at the pelvic girdle. And the pelvic girdle is where we're going to have our hip bones that are going to allow us to motion around our legs. Now, in flesh tone, or I keep calling it flesh tone, but it's really kind of like a little off-white, those bones are going to be part of the axial skeleton. And the axial skeleton gets its name because those are going to be your bones that make up the axis, your midpoint, your center line. So as you can see, we're going to talk about all the bones that make up your skull. We're going to take a look at the bones that make up your chest cavity. And we're also going to take a look at the bones that make up your vertebrate column, which is basically down the middle of your back where we're housing the spine. Now I'm going to try my best to go in order of your study guide, so that way you can kind of see what the bone looks like, what are some things we have to know about the bone. So let's go ahead and refer back to our Chapter 8 outline, and it says right here that when we start looking at the axial skeleton, we are going to start right on top and take a look at the skull. Beautiful. So here's our skull. These pictures are right out of our lecture book. And one thing that I do want to point out to you is you're going to notice that McGraw-Hill did an excellent job color coding the bones. And it will maintain the color for the individual bone, so it makes it easier for you to see its orientation as we look from the front aspect, the lateral or side aspect, and obviously the occipital or the back portion of the skull. So notice how there's a little key on the left-hand side. And I want you to take your time as you maneuver through this PowerPoint, because I really do want you to get comfortable knowing all these bones. And it's going to take a little bit of a practice, especially if it's something that you haven't done before. So please take your time, and let's go ahead and start exploring the bones that we find in the skull that are also classified as cranial bones. The cranium is the section of the skull that houses the brain, so it's going to be this domed formation right here. And what we see happening is that if we want to identify the bones there, according to our list, and I'm reading this right off my little PowerPoint or my Microsoft Word document to make sure I'm telling you the right thing, it's going to involve 8 bones that are in contact with meninges. Quick note, meninges are connective tissue coverings that we find wrapped around the brain. We're going to talk more about them when we do our nervous system chapters. So these are the bones that will come in contact with the coverings that surround and protect the brain. And it's going to be 8 bones that make up these cranial bones. You are going to have your frontal bone. That's what makes up the little forehead. You have one of those. Then on the side, you have, towards the top, you have the parietal bone, highlighted in this darker pink color. You have 2 of them, one on the left and one on the right. Then you also have 2 temporal bones. The temporal bones are right below the parietal bones, highlighted in purple right here. And as you can see, you have one on either side. Then you have your ethmoid bone. This one's going to be a little bit harder to see from this angle, but it basically sits behind the nose. It makes up part of your nasal cavity. It's right over here. It's highlighted in this beautiful green color. You can see peeking through the little nose as well as the eye socket. You have one of those. Then you have another bone. This is probably one of my favorite bones. It's called the sphenoid bone. And it's peeking out here through this nice blue color. In a little bit, when we talk about the sphenoid bone in more detail, I'm going to show you how it has like this butterfly, or some people say it looks like a bat overall shape, making it very interesting to look at. And there's only one of those. And then in the back, we're going to have to switch views. We're going to find our final bone that makes up the cranium, and that's going to be the occipital bone. That's going to be the bone all the way in the back of the skull. So, frontal bone, 2 parietal bones, 2 temporal bones, 1 ethmoid bone, 1 sphenoid bone, and your occipital bone. So those 8 bones make up your cranium. And what we're going to do is we're going to explore these bones a little bit further, as well as all the other ones that make up the skull. So let's go ahead and go back to our list, and let's take a look at the frontal bone. Saw that one already. That makes up the forehead. Here's another look at it from the side, so we can see our little frontal bone. Notice how the colors are exactly the same, making it easier for you to track what makes up the forehead. And then, by the way, for those of us who are like, what does she mean with the occipital bone? That's this one right here. We're going to talk about that one more as well. It's that backbone. All right, so let's take a look at our list. It says frontal bone, its location, forehead, right? So if you were getting ready for your exam, I would want you to know, 1, the frontal bone is part of the skull. I want you to know that that means that it's part of the axial skeleton. And I want you to know that it makes up the forehead. So a very simplistic question on your exam could be, which bone makes up the forehead? And then you're just going to say, oh, that's easy, the frontal bone. You can do the same thing for our next bone on our list, the second one, and that's the parietal bone. Now the parietal bone is going to be more towards the side. Look for that bright pink bone, sits right there on top. Remember that you have two of them, so in parentheses I put two. And as you can see, I said its location is going to be the top and side part of the head. So for the frontal bone and the parietal bone, please be sure that you can tell me what its location is. And we're going to keep up that trend as we keep exploring. Our next bone, number 3, is the temporal bone. The temporal bone is right below the parietal bone. It is in this dark purple shade. You can see it right over here. You also have two of them. They are located on the side of the head towards the bottom. And then now, if you look at your list, you're going to see that I have a little subsection underneath the temporal bone that I wrote down, notable structures. Whenever you see these, I want you to pay special attention because these are going to be items that are going to be unique to a specific bone. And I want you to be able to tell me that they belong to that bone, as well as if they have a particular function. So for instance, in my temporal bone, my first notable structure is my external acoustic meatus. Let me highlight that for you. I'm going to switch colors to purple. External acoustic meatus. That was a horribly crooked line that I just drew. Acoustic means sound, and meatus means tunnel or hallway. So if I'm looking at my illustration, it's this little opening right here. Now, many of you might be going, isn't that my ear canal? And you would be completely correct in that as well. So notice how I wrote down for you, external acoustic meatus is ear canal. So that means that on your exam, I could say to you, what is the ear canal called? And you could say the external acoustic meatus. Or I could say to you, the external acoustic meatus is part of what bone? And you'll say the temporal bone. Another one, how about this one? Styloid process. A styloid process is almost like a spiky extension. And as you can see, it's been highlighted for us right here. And it's this almost like dagger-like spike that sticks out from the temporal bone. It is an excellent site for muscle attachment. And in fact, when we do our muscles in a few chapters and we start taking a look at all the different muscles we use to move our jaw, for things like chewing and talking, you're going to see that the styloid process comes in very handy as an attachment point. Next, we have a mastoid process. That's going to sit a little bit towards the back of the temporal bone, and it's this beefy extension right over here. That's the mastoid process. Also another site for muscle attachment. Now I'm going to switch views because our next notable structure is called the jugular foramen. Anytime you see the word foramen, I want you to think opening or hole. So we're looking for an opening or a hole, and in this case we're looking for the jugular, which means it's going to be in the neck or the throat region. So we're going to have to switch views. This is a lateral view when we look from the side, and we're going to have to look down the skull to see where we need to go. So before we get there, just another look at your temporal bone here in purple. And then also in your book, I kind of like the fact that they have a median section, meaning that the skull has been sliced in half. So you can see its internal workings and you can see how the bones then connect. And by the way, this is where your brain would be sitting, right over here. So you can see those bones that make up the cranium, which is how we started our discussion. Alrighty, oh, I like this picture as well. So here we have what we call an articulated bone. An articulated bone is a bone that's been removed so that it can be highlighted alone. So you can see the temporal bone has been removed from the skull, and then this is what it's going to look like by itself. And I went ahead and I highlighted for you some of the structures we've already discussed. Our little styloid process, there's the little sharp extension. Our mastoid process, here is our little ear canal opening, so that's our external acoustic meatus. Some books will call it the external auditory meatus. Both of them are fine. And then also, let's take a look at this one, zygomatic process. And I'm going a little bit out of order, but it is on your list of notable structures. but the zygomatic process is going to be almost like a bridge formation that's going to allow you to connect the temporal bone to the zygomatic bone. The zygomatic bone is up front right here. I'm highlighting it right now. It's also called your cheekbone. So what you can do is, if you take your fingers and you tap by your cheek and then go laterally to the side, you're going to feel like the bone almost dents in. That's the zygomatic process that you're feeling. It's a little channel-like extension bone that connects the temporal bone to the zygomatic bone. So it's called the zygomatic process, and that's this little bridge-like extension right here. Okay, so I did not forget about the jugular foramen. Here we go. This is the view that I need. So this is what we call an inferior view, meaning that we're looking down what's happening at the bottom of the skull. And what we're going to see happening is we're going to go ahead and look for our jugular foramen. Now remember, use your color code, right? So the temporal bone was purple. So notice also that I've highlighted to make it a little easier. And here's my little jugular foramen right over here. And when you look, follow the arrow, you're going to see it's a small little opening right here. Remember how I said foramen means opening or hole? And this is going to be excellent for some of our nerve passages. You also have the carotid canal right over here. The canal is a little bit larger in shape. This is not the best picture of it, but as you can see, it sits right over here. The carotid canal's function is to provide an opening for the carotid artery, which are some of the main blood vessels that will run from the skull all the way down the throat. So that is your carotid canal. And for those of us who are looking at our list, which I hope is all of us, you can see that the zygomatic process comes next. That's the bridge-like formation. And basically on this illustration, we could see it as well. It's this little bridge right here. There's your little zygomatic process. So see how it connects to the zygomatic bone, which is this light blue bone right here. All right, and then the last one, there's quite a few exciting things on the temporal bone. We have our mandibular fossa. A fossa is a dip or an indentation. It is highlighted for you right over here. And you can see it's a little depression. And the reason the mandibular fossa is so important is because your mandible, the bottom part of your jaw, has an extension that will fit right into the fossa. So your jaw will kind of click into place in the mandibular fossa, thereby attaching the lower jaw to the rest of your skull. So that's the mandibular fossa. You're also going to notice that, or at least I think, when you get to know some of these bones, that a lot of times within the name itself, it will tell you what it's doing. So for instance, mandibular fossa, mandibular means it involves the mandible, which is the bottom part of your jaw, and fossa means it's a dip. So it will kind of hint you as to where you're going. So that makes it easier for you to kind of relate it to a bone that's going to be located on the side of our face, right? Because that's where our jaw attaches. So that makes it easier for you to be like, okay, well, that must be my ethmoid bone, purely based on its overall location. Now, while we're here, let's also take a look at our next bone, which is going to be our occipital bone. So our occipital bone, we have one of them. It is highlighted in green. I'm going to switch colors so I don't confuse anybody. Highlighted in green right over here. It is the backbone. And the occipital bone is going to be extremely important because it has a very large opening called the foramen magnum. Remember, foramen means opening. And this opening is important because that is where your spinal cord is going to exit the brain and go down the vertebrate column. So you can see it right over here, foramen magnum. And then we also have, I like to describe them as little kidney bean structures on both sides of the foramen magnum. Here's one, here's the other. These are called the occipital condyles. And the occipital condyles are going to connect to the first the first vertebra. So they're going to sit on top of the first vertebra. That one is called the atlas. Some of you might have learned it as C1, since it's the first one that makes up the cervical vertebrae. So that's your little occipital condyle. These two little kidney-shaped items that sit on the occipital bone and connect with the atlas. All right, now how about this bone? This one is number 5 on our list. It is called the sphenoid bone. The sphenoid bone is best seen if we take off the cap of the skull, and we see it here highlighted in blue. This was the bone that I was mentioning to you before that looks like, I think it looks like a butterfly, but some people say it looks like a bat. Either way, it has a very unique shape. On the left-hand side, you can see what the bone looks like when it's removed from the skull. In the sphenoid bone, there is going to be the structure called the sella turcica. And the sella turcica is this part right here. It is a little dip, and it's extremely important because it's going to house your pituitary gland. Your pituitary gland is this little gland that kind of dangles, from your brain, and it is extremely important for your endocrine system, which is the system that produces and releases your hormones. And the pituitary gland will be housed right there in the sella turcica, which actually means camel's seat. So it's a housing mechanism for where your pituitary gland is housed. When we get to go into our second part of A&P 2086, one of the first chapters you will do will be your endocrine system. And when you get there, you will definitely hear about the pituitary gland, and you will hear another mention of the sella turcica. So please remind yourself that that is part of the sphenoid bone, which is located in the cranium fossa, because those are the little dips that the brain sits in within the cranium. All right, next on the list is going to be our ethmoid bone. The ethmoid bone is the deepest skull bone, and if you don't mind, go ahead and take a look at the little skull picture at the bottom, and notice that they've superimposed or highlighted for you the ethmoid bone to show you how it's almost hiding behind the eye sockets and the navel bone, and it makes up part of our little nasal bridge on the inside right here. This is what the bone looks like when it is removed from the skull. It has some very unique structures. One of them, or I should say two of them, are the cribriform plate and the crista galli. The cribriform plate and the crista galli can be found towards the floor of the cranial. So if we take the skull cap off, you would see it. I'm going to show you a view of it in 1 second. And the crista galli is going to be that protrusion, this part that kind of sticks up, whereas the cribriform plate is on the side right here. The crista galli forms almost like a little sharpened, extended ridge, and it will provide attachment to the dura mater. The dura mater is the top meninge, the top covering of the brain. So the dura mater will kind of attach, and it will allow the brain to kind of float around in the cerebral spinal fluid, and it will have that little attachment point in the crista galli. You also have the perpendicular plate, which will run towards the middle of the ethmoid bone, and this will make up top part of your nasal septum. So the fact that you have, when you look up your nose, you have a left and a right. The nasal septum is basically the division wall of that. The top part is made up from the perpendicular plate, courtesy of the ethmoid bone. Now, since we're talking about the skull, we definitely want to take a look at sutures. Sutures are an example of a joint. A joint is a meeting point between bones, and a suture is what we like to call an immovable joint, meaning it's not going to be moved. It's basically like super gluing the bones together. It's not going to allow for any flexibility, and this makes sense because obviously you want to make sure that your brain is well protected. So there are 4 main sutures when you take a look at the skull that you should definitely know, and I would also like you to know which bones they're going to be connected. So let's start off with the easiest one, which is the coronal suture. I like to think of that one as the easiest because when I hear coronal, I think of crown. And when you wear a crown, you wear it right there by your forehead. So the coronal suture is what's going to connect my frontal bone to my parietal bones. So here's my little suture. Here's the little line. The next one is going to be my sagittal suture, and that's going to run on top of my skull, and it's going to connect my two parietal bones. So that's my sagittal suture. Then I have my lambdoid suture, that's more towards the back. That one, right over here, is going to connect my parietal bones to my occipital bone. And last but not least, we're going to have the squamous suture. That one is going to be more towards the side. It's going to connect the parietal and the temporal bones. So we're going to have to switch illustrations to see that one. Here we go. So now we're looking at it from a lateral, a side view, and you can see your little squamous suture right over here. Beautiful. Now, please keep in mind that there are plenty of other sutures. There's also what they like to call micro sutures along the way, but these four are the main ones. So please know the coronal, the sagittal, the lambdoid, and the squamous suture, okay? And then what we can do is now we can take a look at our facial bones. We're still on the skull. We're going to go ahead and take a look at the other bones that make up the face, so the front part of our skull. So let's start at the bottom, since we've already done most of the bones, right? We've done the frontal bone. We already know that one. We've done our little ethmoid bone that's peeking up to the nasal septum. So let's start at the bottom and let's take a look at this bottom jaw and the top part of the jaw. So we're going to start with the top because I'm looking at my list. I was just about to go out of order. And the top part is called the maxilla. So the maxilla is your upper jaw. Here you go. And I see that for the location, I wrote down upper jaw, beautiful. And then for the notable structures, I have two of them. Palatine process and the alveolar sockets. The alveolar sockets are these little grooves that are actual openings that will house the root of our teeth. And I mentioned these to you before when we were talking about braces and how bones will go ahead and use stress points to help them remodel. So we already knew that they had like little sockets, little attachment points. To see the palatine process, we're going to have to look up the bone. We have to look at the roof of our mouth. So let's switch illustrations real quick. Here we go. And let's go back to our color coding so we can see right here. It's the maxilla. And notice how the top part of the maxilla, so this is what makes up the roof of your mouth. If you take your tongue and you press up against it, that's what I'm doing right now, so I'm sounding extra weird. That is the palatine process. So that's the hard palate of the mouth, okay? The palatine process. Now, I do want to say, and I wrote this down for you on your notes, I wrote down the palatine process makes up 2/3 of your hard palate. So it makes up 2/3 of the roof of your mouth. And the reason for that is behind it, and you can see it's in a slightly different shade of white. Right over here, I'm highlighting it. You have another bone that's called the palatine bone. That makes up the other part of the back of the mouth, okay? So you have your maxillary bone, which is your upper jaw. That one has the palatine process that makes up part of your hard palate, the roof of the mouth. And then behind it, you have your palatine bone, and that makes up the rest of the hard palate. All right, and we can see it's labeled as the horizontal plate, but we can just get away with saying it's the palatine bone. Beautiful. All right, what else do we have going on? Zygomatic bone. Oh, that's our cheekbone. Oh, before we continue on, I just want to show you something because I just noticed it on the illustration that we were looking at. Remember a few bones ago we were talking about the ethmoid bone, and I said to you it has like the cribriform plate and the crista galli, and the crista galli is where the dura mater attaches. So take a look at this picture right here. This is a superior view of the cranial floor. So that means the skull cap has been removed and the brain would be sitting right over here. And you can see your beautiful sphenoid bone, my little butterfly slash bat-shaped bone. And then what I wanted to show you is over here, we have our frontal bone. But then you see this color right here? This is the crista galli and your cribriform plate from the ethmoid bone. So you can see how it extends all the way up to the top of the frontal bone. And then this ridge right here, this little extension, the crista galli, that is where the dura mater, the external layer of the protective barrier of the brain, is attached. In fact, if someone ever gets jammed up the nose, like maybe you're playing basketball and someone kind of like elbows you, what we see happening is that it can produce enough force for the crista galli to actually move upwards and puncture the dura mater. If that happens, what you're going to notice is that the person will have a nosebleed, but instead of red liquid, aka blood, it will be clear fluid. If you see clear fluids, that's cerebral spinal fluid. So you need to bring that person over to the emergency room so that they can double check that there's no concussion or anything more serious happening. Alright, so here is another look at our skull. Let's see where we left off before I started telling you back about your ethmoid bone. Let's see, we did our palatine bone, and then now we are at our zygomatic bone. Okay, so the zygomatic bone is indicated in this beautiful baby blue color. And the best way to describe the bone is that these are your cheekbones. I just noticed that I wrote cheekbones. I gotta fix that. That makes up your cheekbone. And as I mentioned to you previously, your zygomatic bone will be connected through your temporal bone here in purple because it has this little bridge-like formation called the zygomatic process, right? So see how it gets the name of the bone that it's going to? And then if you look now at your zygomatic bone, you're going to notice that it also has a little bridge, not as long, but just a little one. And guess what that one's called? The temporal process, because it's leading you to the temporal bone. So the zygomatic process is the bridge in the temporal bone that leads to the zygomatic bone. And the temporal process is the bridge on the zygomatic bone that leads you to the temporal bone. Whew, try saying that 5 times fast. All right, so that's our little cheekbone. Please forgive my misspellings. Then we have our tears, our lacrimal bone. Our lacrimal bone, right over here, can be found right by the ethmoid bone. It's this little red-shaped bone right over here. It gets its name from the fact that it has a little lacrimal fossa. It's a little hard to see, but it's this little dip right here. And the lacrimal fossa is where your tear sac sits, your lacrimal sac. So when you cry, that's where the water is released from. So your lacrimal bone, which sits inside your eye socket, it houses your tear sac, your lacrimal sac. We also have our nasal bone. That one's easy to find, right? Nasal, that means nose. Get rid of some of these markers. Your nasal bone is right over here. Top bridge part of your nose. In fact, if you hold onto your nose right now and you wiggle it, the part that you wiggle is cartilage. If you move your finger up closer, you're going to notice that you feel bone, and that's the part that you can't move. So that's your nasal bone. It makes up the bridge of your nose. You also have your vomer bone. Your vomer bone is in a very particular place. It's right over here, highlighted in yellow. It basically is jammed between the ethmoid and the maxilla. So the best view of it is really when you take a look at this median section. Here's another look at the vomer, and the reason I like this image as well is because it allows me to tell you that the vomer is going to help form your bottom part of the nasal septum. So here you go. So your bottom part's made from the vomer, and then remember the top part, that one's going to come courtesy of the perpendicular plate of the ethmoid bone. Right, and as you can see here, I went ahead and I highlighted the nasal bone again. And that is this purple structure right here. Beautiful. All right, so let's see. It looks like we're almost done with our skull. We still have to discuss number 7, which is the mandible. So the mandible is going to be our lower jaw. So we had the maxilla on top, and then we have the mandible on the bottom. For the mandible, I wrote down it's the lower jawbone. It is the largest and strongest bone of the face, not of the body, of the face. And I would like you to see the mandibular condyle. So in order to see that, we're going to have to switch pictures so we can see the mandible by itself. All right, here's just a side view. You can see the mandible. Notice how the mandible is connected to your temporal bone. I had mentioned that to you before because remember the temporal bone has that mandibular fossa, that little dip that can house the mandible. And here we go. So this right here is the mandible by itself. And I wanted to show you this part right here, this little back extension part. This is called the mandibular condyle. And the mandibular condyle, those extensions, are going to sit in the mandibular fossa, the little depressions in the temporal process. And when they connect together, they're going to make up your temporal mandibular joint, your TMJ. And it allows for your lower jaw to be attached or hinged to your skull so you can move it up and down. And if you ever had like locked jaw, or if anybody has ever like been punched in the face and their jaw shifted, what happens is because the mandibular condyle will glide out of the fossa. And in that case, it has to kind of be put back into place. It has to be popped back to where it goes. This is also what happens when you do excessive grinding of your teeth. When you're sleeping, you'll wake up and your jaw will really hurt. And that all has to do with the interaction of the condyle with the fossa in the ethmoid bone. Oh, and you know what? Since we're here, remember when we looked at the maxilla, we talked about the alveolar process, you know, the little indentations where the tooth fit in. The mandible has the same ones because obviously we have teeth on our upper and bottom jaw. And I kind of like this picture because notice how they kind of highlight for you how the roots of the teeth are actually sitting within the processes, excuse me. I want to show you that. Alrighty. And I see that next on our list, it says, not a bone of the skull, which is completely correct. This is called the hyoid bone. The hyoid bone is such an interesting bone. It sits at the bottom of your skull. It doesn't make contact with any other bones. It basically is held into place by muscles. So you can see on my little picture right here, my styloid muscle is connecting it and kind of levitating it above. And it basically sits right above the larynx. The larynx is your voice box. So if you take your hand and you put it by the middle of your throat, and if you say something that's vibrating that you feel, that's the larynx. That's your voice box. So your hyoid bone sits right above it, and it looks like this right here. This is what it looks like when we remove it. It's kind of like a U shape. As I said to you before, muscles will anchor it. Also, some ligaments will hold on to it. And then I wrote down on your paper, it sounds a little weird, I wrote down it's a sign of suffocation. And I wrote it down because if you're like me and you like to watch, you know, crime dramas, detective shows, you know, like whodunit kind of stuff, oftentimes if a person is suffocated, it turns out that the hyoid bone, because of the pressure of squeezing the throat, the hyoid bone will actually fracture and break, which will often indicate that as the method of death. So I guess I wanted to share that with you. Ooh. All right, so finishing off our skulls are what we like to call fontanelles. Now, fontanelles are basically spaces between the skull bones that precede the sutures. So these are People like to describe them as the soft spots on the baby. So, like when you hold a newborn baby or a very young baby, they have that little dip right on top of their skull, and they always tell you to be very careful with that. Well, that little dip is a fontanelle. It's basically connective tissue that's anchoring the bones, so it allows for the bones to grow before they settle in place, and then the fontanelles will harden and they will then become the sutures that we were discussing before. As you can see from the illustration, there are fontanelles all over the place, and that is because obviously, one, we're not born with the shape or the size of the skull that we'll have as adults. The bones will still need to grow before they permanently attach. And also, two, when a child is born during vaginal birth, as the skull squeezes through the vagina, the bones will actually be able to kind of overlap a little bit, making it easier for the woman to give birth. So these fontanelles are very helpful for growth, as well as playing a part in the delivery method. You do not have to worry about knowing the names of all the various fontanelles. I just wanted to kind of highlight those to you. I just want you to be able to tell me that they are found in the fetal skull and that they basically give room for the bones to grow before they settle into sutures. Alrighty, so that takes care of our skull. So that now means that we can move on down to the vertebrate column. All right, so here is our vertebrate column. This is still part of our axial skeleton. And the way it's going to work is that sitting on top of the vertebrate column, that's where your skull is. And then now moving downwards, what we're going to see is that these bones are going to help us provide structure and support the weight of the trunk, as well as the lower limbs of the body. And also, very importantly, it's going to help us protect our spinal cord, which is coming as an extension from the brain. And also, it will provide fantastic attachment points for ribs and muscles, and also where the nerves will radiate outwards. Now, the vertebrate column is very lengthy. It just runs down to your back all the way to literally your butt. And what we see happening on this drawing is that it's divided into different regions. So go ahead and take a look at the right-hand side, and you can see that the first region is called the cervical vertebra, and this is going to be 7 vertebrae are going to be stacked there together, and the cervical vertebra basically makes up the neck region. And what we're going to do is the bones or the vertebrae that are anchored there, we're going to call them by their first letter of the area, so cervical, that makes a C, and then we're going to number them starting with 1 all the way to 7. So notice on the illustration how it says C1, C2, and then it continues on until you get to C7. So if I say to you vertebra C5, the C would mean that it's in the cervical region, and the 5 would mean that it's the 5th one going down. You're going to do the same exact thing for all the other ones. So the next region is the thoracic vertebra. That's going to take care of your chest area, and those are 12. So you can see that they start with a T, and you start numbering at 1, and then you stop at 12. So 12 of them are stacked on top of each other. I do want to point something out. It turns out that your C1 and your C2, so the first 2 vertebrae, they also are going to be called the atlas and the axis. In fact, those are actually their more popular names. So they get a distinguished names, atlas and axis. We're going to talk a little bit more about them, and yes, they are on your list. These are special not only because they are the first 2, but also because they will allow your head to rotate in a yes or no pattern. And they look slightly different than a typical vertebra. But either way, so you have the cervical, that's 7, the thoracic, that's 12. Next is going to be the lower by the hip region. That's going to be the lumbar vertebra. Of those you have 5. Then leading in between the hip bones is going to be the sacrum. The sacrum starts off as 5, but in adulthood they will actually merge together and fuse into a solid bone. So the sacrum, we're not going to put a number there. Just know that as a child, you tend to have more bones as an adult because a lot of the bones will kind of fuse together and become one solid entity. And then the last section of the vertebrate column is going to be called the coccyx. This is your tailbone. So if you ever fell right on your butt and it hurt, that's because you probably hit your tailbone. If you have any pets at home, like if you have dogs or cats, their tail is basically also called the coccyx, but it has more vertebrae on it, so that's why it's an extension. We don't have a little extension. We don't have a tail. Those also tend to be individual ones that will fuse together as an adult. So on your notes, I wrote down coccyx is just one, but it used to be 3 to 5, depending on individually. It can vary in numbers. So that's your little tailbone. A quick trick to remember the numbers, 7, 12, and 5, and it's really silly. Think about breakfast, lunch, and dinner. 7 o'clock is when we'll have breakfast. 12 o'clock is for lunch. And 5 o'clock is early bird dinner. Early bird dinner is usually with the old people that eat super early. I'm down for that because that just means you can have an afternoon snack. Why not? 7, 12, and 5. Now, when we are looking at the vertebra, it turns out that they will stack on top of each other, and they will either form a concave or convex formation, meaning that they'll either fold inward or outward. So here, for instance, when you take a look at your cervical and your lumbar curvation, notice how they fold inwards. Whereas the thoracic vertebra and the pelvic region, they fold convex. And these curvations are important because it allows us to still provide resilience as we're able to carry all our weight, but yet be flexible so that we can have movements within the thoracic region. You know, you could twist your body side to side, swing your arms and legs, and still be able to carry all your weight and not fall over due to gravity or any other sources. Now, here's a little interesting fact. You are not born with these curvations. These will literally start forming as you start lifting your head and crawling and walking. So I added a little picture of the baby. Look at the cute little baby. And babies are super flexible, partly because they do not have the curvations. And that's also why when a baby is born, they can't lift their head because the bones haven't learned to support it yet. So over time, what we see happening is when the baby starts lifting the head up and down, that's when they form the cervical curvation. And then the rest of the curvations will come as they start crawling and then move over to standing up and walking. So that's a little FYI. All right, so here we just have a few vertebrae stacked on top of each other because on my list, I do have a section that I wrote for you, vertebral structures. And there are 7 entities to point out. The first part is what we call the body. The body is the bulk of the vertebra. It's this section right here. It basically carries all the weight. Not all vertebrae will have bodies. I'm going to show you which one don't. And some vertebrae will have a thicker body than others. Usually, as you migrate down the vertebrate column, you carry more weight towards the bottom. So those will have a heavier or a thicker body because just of the weight that they're exposed to. You have an opening in the vertebra where the spinal cord will pass through. This is not a good angle for it. It basically is the opening that you would see this way. I'm going to switch views in just a little bit, but this is where the spinal cord will run through and it will sit in the vertebral foramen. So you can't really see it this way, but what you can see is that when you stack the vertebrae together, you also have little openings on the sides, and these are called the intervertebral foramen. Inter means in between. So in between the vertebrae, you'll have little openings, and that is where your spinal nerves are going to radiate out of. Then you have the spinous process, which is an extension on the back or the lateral side of your vertebra. And what you can do is you can basically take your hand and run it down the middle of your back, right where your vertebra is, and you're going to see little nodules. That's the spinous process that you're feeling. That's the little extension that you're feeling. Our next entity says giraffe versus moose. That sounds a little funny, but it turns out that the vertebrae will slightly look different in their structure composition depending on where they're located. So let me show you what I mean with that. Okay, so take a look at this illustration right here. We have a representation of the cervical region. So that's the neck region, not a lot of weight to carry. The thoracic region by your chest, and then the lumbar vertebra. Notice how you go down the body, down the body overall. The body of the vertebra gets thicker, and that's because it's carrying more and more weight. Okay, this is the spinous process that's sticking out. Now, for those of us who are in lab, we're going to have to know exactly what these vertebrae look like in their individual regions. So what I found is that if you were to compare a thoracic and a lumbar vertebra, one of the ways that you can distinguish them is that one of them will look like a giraffe and the other one will look like a moose if you're looking at it from a lateral or side view. So here, and I really should insert a little picture for you. I'm going to do that post my little recording so you can see it. But here is my little giraffe. You see its little snout, its little face, and then this right here is my moose. So if you hold it on the side, that's one way. Obviously, you can also just remember that the spinous process in the thoracic region tends to point more downwards, where in the lumbar region, it's a very thick body and also a very astute spinous process. Another thing to point out, and also, by the way, I forgot to show you this on the previous picture. These large openings, those are the vertebral foramens. That's where your spinal cord is running through. Here you can see it from this angle. So out from the brain through the occipital foramen, the spinal cord will run through it. And it doesn't run down the entire vertebrate column. It usually ends right by L1, L2. So that's a little FYI. Either way, these two vertebrae look very different than the rest. And that's because this is your C1 and your C2, also known as your atlas and your axis. So these are the two first vertebrae that come into contact with your skull bone by the occipital bone. So on your Microsoft Word document, I wrote down the atlas is also known as C1. Notice how it doesn't have a body section. It will come into contact with those occipital condyles. Those are the ones that look like little kidney beans when we were looking at the occipital bone. And the atlas will allow you to move your head in a yes formation. So it will allow you to go up and down, yes. Your axis is C2, so it's the second vertebra. This one has a little dense process, a little extension right here called an odontoid process, and it will allow it to anchor. Let me erase this part. It will allow it to anchor onto the atlas, see right here, and by doing so, it will allow your head to motion no. So yes, up and down, no, side to side. Am I the only one shaking my head right now? So these are the unique vertebrae. These are your C1 and C2. And if you ever forget which one is first, it's in alphabetical order. So atlas before axis, C1 and C2. I also wanted to point out that in between the vertebrae, you will have your intervertebral discs. These discs are little cushion pads that will allow you to kind of observe some of the shock from the vertebra. You can't really see it on this picture. There's little tiny ones right here. But the best one is to kind of just go back one and take a look at the little gelatin pads that sit between the vertebrae. So that way the bone doesn't grind against each other. So it's excellent for shock absorption. It's mostly made out of fibrocartilage as well as lots and lots of collagen fibers. All right, last one for our axial skeleton. This is going to be our thoracic cage. So this is going to be what is housing and protecting our lungs and our heart. This is what's going to make up our thoracic, our chest cavity. And what we see happening here is it will also provide an anchoring point for our shoulders. That part will be part of the appendicular skeleton. So here in our thoracic cage, there's going to be three things we're going to have to look at. The first one is going to be the fact that we have the thoracic vertebrae that are running in the back of it. So you can see them peeking out over here, your thoracic vertebra. You will also have your sternum. Your sternum is better known as your breastbone. So that's the bone you feel if you take your hand and you palpate right by your chest area. It has a manubrium section on top. It has an elongated body. I always think it kind of looks like a little tie. So this is like the knot of the tie. And the body is kind of like this length part of the tie. And then at the end, it has a little tapered section called the xiphoid process. It's right over here. The xiphoid process is used for muscle attachment, but many of us have probably learned about it if you've ever taken a CPR class. That's the end part you look for before you start pressing up and down, because the heart sits right over here in this location. So if we're giving our compressions, we want to make sure that we're not full on cracking the bone, that we're making contact with the heart. All right, now on the side of our thoracic cage, let me just get rid of all these drawings. We have to discuss our ribs, and there's 12 sets of them. We have what we call true ribs. Those are going to be the first 7. A true rib means that the rib bone makes individual contact with a cartilage before it connects to the sternum. So if you look at numbers 1 through 7, you're going to notice that each of them will connect with little costal cartilages here in white, and each of them has their own connection. So that's what makes it a true rib. Then if you look at ribs 8 through 12, those are going to be classified as false ribs because they don't have individual one-on-one connections with the sternum. In fact, if you take a look at ribs 8, 9, and 10, you're going to notice that they do have cartilages, but notice how the cartilages kind of merge together collectively, and then they piggyback off number 7 to connect to the sternum. So they don't have their individual 8 connects by itself, 9 by itself, 10 by itself. And then within the false ribs, there's a subcategory that's going to take care of ribs 11 and 12. Those are called floating ribs. Floating ribs means that they have absolutely no connection to the sternum. They will only connect to the vertebra section of the body, as all the other ones do, okay? So your floating ribs are 11 and 12, which are a subcategory of false ribs, and the other false ribs are 8 through 10, as they're sharing the costal cartilages to the sternum. Whew, all right, fantastic job. So that will take care of the axial skeleton. Remember, take your time, walk your way through it, and whenever you're ready, part 2 will take care of the appendicular skeleton. So we'll talk about that one next. Have fun.